Breaking news now, and UK health officials say everyone over the age of 50, as well as health workers and those most at risk of complications from COVID-19, will be offered booster jabs in the autumn. It comes as cases of coronavirus continue to surge across the UK, with an increase of almost a third in the past week. Joining me now is Professor Adam Finn, member of the Joint Committee on Vaccination and Immunisation. Thanks so much for joining me, Professor Finn. So the recommendation, as I think I'm right in saying, a couple of months ago was for those over 65 to get the booster shot. Clearly, the government's enacting those over 50. Talk us through why suddenly we're increasing the number of people that need to get this booster.
Yes, good afternoon, Wilfred. There's always been clear that we were going to need a booster program and that age was going to be the critical factor in determining exactly who should be targeted for these vaccines. But it wasn't entirely clear earlier in the summer where the line should be drawn. I think the evidence we've now seen makes it clear in terms of what we're seeing at the moment that we should go for a very straightforward, simple and clear program of offering both influenza and COVID boosters to everyone over the age of 50, as well as people who, for other reasons, are at high risk of serious illness. Because what these vaccines can do is to keep you out of hospital, keep the NHS going, and minimize the chance of disruption when we get to the depths of the winter.
And again, just talk us through why it's so crucial to do as we approach winter, as opposed to, as you're saying already, these cases have been shooting up of late. Why will it get worse still in the winter?
Yeah, it's always hard to predict the future. And I guess while we knew that we might be seeing a wave at this time, we certainly had no strong expectation of that happening. This virus continues to catch us out and do the unexpected. But if you look back over the last two winters, we have seen significant waves in the wintertime. And indeed, we do see that every year in normal times with all of the other respiratory viruses that circulate around. So particularly December, January, February, sometimes into March, very difficult periods for the NHS every year, with lots of people, particularly old people, being admitted to hospital with respiratory infections. So although we can't guarantee it, it's certainly a serious risk that this will happen again this winter. And we want to protect against that happening as best we can.
And just to clarify, so the flu, the influenza vaccine, is that the same recommendation, only those over 50?
Exactly right. So in the past, flu vaccines have been offered to the over 65s. Again, it's an illness that is particularly a problem for the elderly. Last year, we extended that down to the age of 50, and we're doing exactly the same thing this year. We really do need to protect the health service as best we can, and the risks of serious illness do go up with age. Certainly by the time you get to my age in the early 60s, you are an at-risk person. So people like me and my age group definitely need to be immunized as well.
In terms of why we're only going for the over 50s and not everyone again, or all adults again, is that because of a good reason? Because younger people don't need it and then the variants now aren't too threatening, or a bad reason because we don't have the supply, or we don't have perhaps the ability to distribute it quickly enough?
No, it is a good reason. We are seeing very little serious illness now in healthy younger people, both adults and children. And I think that's a combination of the vaccinations many of them have received, as well as the fact, of course, that most people have now actually had COVID at least once, in addition to being vaccinated. So there's a lot of immunity out there in the population, and we're not seeing significant problems with serious illness. Now, these vaccines are not very reliable at preventing infection, as many of us have discovered in recent weeks and months, but they do reliably protect against serious illness. So we need to target them at the people who are at risk of that serious illness, and that is the older people, not the younger ones.
And just finally, Professor, whilst we've got you here, a comment on the latest numbers. I think we saw they go up by a third this week. Again, is this a sort of case of they're worrying, we've got to keep an eye on it, but given that hospitalizations and deaths aren't following suit to the same extent, that we don't need to be too worried?
Well, I think it is worrying. I mean, it's an enormous number of infections, and it's certainly being very disruptive. A lot of people in my clinical research team and laboratory are off sick with COVID at the moment, and I'm sure everyone who's listening to this is being affected by it one way or another. So it's not a trivial problem by any manner of means. And in addition, as you just heard in your previous report, we're seeing significant pressures on the health service right now, which is very uncharacteristic for this time of year. So I think people should recognize that this is not trivial. It does need to be thought about, and any efforts that people can make to try and reduce the transmission of infection will help bring that peak down.
Professor Finn, thanks so much for joining me. Much appreciated.